Campaign to end the HIV epidemic by 2030 brings healthcare equity to the south side of Chicago. Here to tell us more about that, Dr. Tyra Dean-Ousley and George Lambo of Leap for Health. Thank you both for being here.
Thank you for having us.
And Happy New Year to both of you.
Happy New Year to you.
When we're talking about this, Doctor, you started Leap for Faith during the pandemic. What was the need that you saw that you said, I need to do something about this?
So outside of people panicking about COVID, there were the general ear infections, sore throats, hypertension needs, diabetics, people who needed their primary care needs met outside of COVID. That was the main focus for creating Leap for Health.
When you're talking about this, George, obviously COVID took the entire world over in 2020, and that really overwhelmed the healthcare system, but people still had their everyday needs. And that's so important, especially in marginalized communities like we have around Chicago.
Right, correct. And so looking at the need and saying, okay, how do we go out there and make a change? Because remember, the problem is in the minority communities, we don't meet the need until it's critical. And COVID wiped out a lot of people because of underlying health conditions that could have been addressed if it would have been caught before COVID.
Well, Doctor, tell us about the HIV rates and how they differ between the different races when we're looking at healthcare. And usually when you're looking at white, Asian, Latino, and Black, it's usually the Black communities where you see the increasing numbers.
So the number one issue related to any disease, and HIV particularly we're talking about, is access. People don't have access, people don't have awareness, and the other thing is they lack education. So what we do is provide access on the south side for people who are in marginalized communities to bring health literacy, to educate them on the importance of their healthcare needs to decrease HIV results by 2030.
And there are medications now that you can take, 2 of them that are approved by the FDA. Talk about those which will almost eliminate the transfer of HIV from one person to another.
So both of those medications only work when they're compliant.
Correct.
So we provide education to our patients that revolves around primary care, meeting their healthcare needs outside of decreasing HIV. Also, the importance of taking the medication. There's a health screening that they have to do to ensure that there's no liver function and the issues associated with that. So we provide that education to our patients to decrease and eliminate HIV in our communities.
And George, that is called PrEP. It's pre-exposure. That's for people who are HIV negative, correct?
Correct, that's correct.
And then people who are HIV positive, also if they're compliant with their medications, tell us about that and bringing a viral load down to undetectable. What does that mean?
Right, so what that simply means is by taking the medication as prescribed before, again, as they say, you have to come out being negative, and then what you do is we give you the medication and you take it before, and what that does is keep the viral load down, keep you undetected for HIV and AIDS. And so the objective is to empower you to say, okay, take it as prescribed, because remember, 25 years ago, this didn't exist. We've come so far in the growth maturity of technology regarding, again, HIV and reducing AIDS. And that's why we champion behind the campaign, Step Up, Prep Up, 2030.com, to say, hey, there's a solution. Let's just follow the guidelines and make it work. So by 2030, we could eradicate this deadly disease.
In the new year, what is Leap for Health going to be doing to make sure that its mission continues?
Providing awareness and education to our community and our communities of interest.
All right, Dr. George, thank you so much.
Thank you.
Do appreciate it. For more information, you can go to leapforhealth.org, or you can find them on Facebook. The information there right on your screen. We'll be right back with Weekend Break.